All right, welcome to Portal to Health, using the patient portal to support chronic conditions, microlearning series brought to you by the California Telehealth Resource Center. This kicks off session 2, Microlearning 2 Policy Development. Before we begin, we want to note that this session is purely for informational purposes, and CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during this webinar series.
And the California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative services with providers and patients located across all 58 California counties and beyond. As part of a collaboration of 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC became part of OCHIN in 2017 and together reflect 25 years of practice-based solutions expertise. OCHIN supports safety net health organizations and serves over 6 million patients in 49 states. The OCHIN Health Center Controlled Network, or HCCN, is the largest HCCN in the nation. Health Center Controlled Networks are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology. This is very much akin to CTRC and other telehealth resource networks. OCHIN HCCN supports 113 participating health centers using a variety of electronic health records and serving over 4 million patients. It is funded by HRSA. We welcome you to check out the OCHIN HCCN webpage to learn more.
And this is who we are. So I am glad to be joined by my wonderful colleague, Lulu Gonzalez. Her and myself, we are learning content designers, and we work with California Telehealth Resource Center. Before we jump in, here's a list of all the microlearnings in this series. Each session's designed to deliver quick learnings on specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. So with that, we welcome you to Microlearning 2 Policy Development.
So policies reinforce what the patient portal is designed to manage and help establish what content and functionalities fall outside of what is appropriate portal use. So first and foremost, since the portal is largely an asynchronous solution, patients and staff must clearly understand that the portal is really only appropriate for general medical questions or for follow-up to their condition. It is not intended for emergent or urgent conditions, nor is it meant to take the place of medical appointments. The portal is also for routine healthcare, such as prescription refills, viewing lab results, and requesting appointments. A character limit can help keep those messages clear and to the point. As a rule of thumb, if a patient has a series of complex health questions, the portal is not the best place to address issues that truly require an appointment with the provider. Instead, providers can triage based on clinical criteria, which appointments may be conducted virtually or in office. We recommend consulting with your operational champion, clinical champion, legal or compliance champion, your patient champion, and others as you craft policies and protocols for your organization. So, when implementing a patient portal, having clear terms of use policies is really key, not just for regulatory compliance, but also to set expectations for both patients and staff. These policies act as a guide for how the portal is used, ensuring consistency, security, and a smooth experience for everyone. So first, patient eligibility criteria policies, or terms of use. First, it's important to define who is eligible to use the portal. Are there age restrictions or specific requirements for registration? For example, will minors under a certain age have limited access to certain health information? Defining this upfront helps avoid confusion and ensures compliance with privacy laws like HIPAA and state-specific regulations. Proxy accounts. Proxy accounts are essential for caregivers, parents, or legal guardians managing a patient's care. Your policy should outline how these accounts are created, who qualifies as a proxy, and how privacy is managed or maintained. For example, what happens when a minor reaches the age of medical consent? It's crucial to have a workflow for transitioning proxy access appropriately. Releasing sensitive results. California mandates that the provider who ordered the lab or imaging test be responsible for releasing results to the patient when requested. The 2022 SB 1419 bill builds in time for the physician to interpret such sensitive results before releasing electronically to the patient. Very sensitive results must be delivered orally. Consult your legal team to develop organizational policy on results release that uphold California law. Refer to California state rules or sensitive lab results release. Patient messaging. Messaging is one of the most popular portal features, but it can quickly become overwhelming without boundaries. Your policy should clarify what type of messages are appropriate for the portal, expected response times, and what to do in case of emergencies. For instance, make it clear that the portal is not for urgent medical issues and outline how patients should contact the clinic in such cases. You can also consider placing a character limit on incoming messages. Somewhere between 250 and 500 characters are common limits. And when it comes to language, consider how the portal will accommodate patients who prefer languages other than English. Are there multilingual support options available? If certain parts of the portal are not translated, this should be clearly stated in the terms of use. Additionally, make sure staff are aware of how to support non-English speaking patients through interpretation services or other resources.
Right. So as noted, messaging is one of the most impactful functions of the portal, allowing patients to communicate with their care teams and other health center staff anytime, which can support certain chronic care management requirements. However, it is critical to ensure patients understand that these messages do not receive instant responses, and urgent needs warrant a different means of communication. A standard response time for patient messages is anywhere between 1 to 3 business days, with 48 hours being a good goal. That said, 24-hour response times are ideal when possible. But of course, response times are heavily influenced by staff capacity, volume of messages, and time sensitivity. And so make sure that your portal contains messaging that urgent or emergent conditions are not intended to be addressed through the portal. And for this, patients should go to urgent care or use the ER for emergencies. Patient message routing and triage is a powerful tactic to remain patient-centered and reduce staff burden. There are several benefits to using message routing in pools. Messages are less likely to get missed and can be acted on appropriately. Administrative staff burden is reduced and clinical staff experience with less inbox bloating. Support staff can be empowered to work at top of license for certain responses. And routing and triage also help ensure timely, efficient, asynchronous communication that can prevent avoidable in-person visits, keeping the schedule more open for those who need appointments and lessening travel and time needs for the patient. Typically, message routing and triage works using filters and pre-established pools. When a patient sends a message, it is categorized and filtered to the appropriate pool inbox. The patient should already be aware that about potential response times, and those in the pool review the message and take the appropriate action, such as responding or assigning an urgency level and forwarding the message to a clinical staff member.
So let's walk through an example. In the one that you see on your screen, the health center has 2 pools. So the patient message is identified as clinical or administrative, and then it is routed to the respective pool. Once in the pool, it is reviewed by designated staff who can triage it based on the question or the issue. On the admin side, this may include billing questions, scheduling requests, or even updates to demographic or insurance information. On the clinical side, the message will be assessed for time-sensitive, symptom-based questions, and then routed to either a nurse pool or a clinical support staff. If needed, it can be further escalated to the provider. And then one more policy to consider is when to convert a message or inquiry to a scheduled visit. This can prevent unnecessary and sometimes harmful back and forth between the patient and the health center. Some common reasons to convert to a scheduled visit include complex issues or new issues that the patient has not been seen for, the issue requires a physical examination, and the need is too urgent or time sensitive for asynchronous communication. A patient's condition has significantly changed or needs an adjustment or change for certain medications. there have been more than a designated number of messages about the same issue. So consider adopting protocols that take the provider out of this decision-making process for some circumstances. For example, if you have a policy including one or more of these criteria, the message can be flagged for a canned response about scheduling a visit. This could be automated or handled by the initial review pools. Not only can this approach reduce clinician burden, but it can also prevent miscommunications for both the provider and the patient.
So we've all heard the adage that for things like self-care, that if you don't have time, you have to make time. And this can really apply to staff functions around the portal as well. So consider blocking out regular time during the day to read messages or monthly policy or training or quarterly practice or role play. So policy can support this practice. And we are wrapping up Microlearning 2, so we do have a couple key takeaways for you. So clear policies help manage patient expectations, can ensure compliance, and create transparency for both patients and staff. We highly recommend consulting with your legal team to ensure that all your policies align with California requirements, and also recommend blocking out time for daily, weekly, monthly, quarterly, and annual portal-related tasks.
Yes, so what's next? Microlearning 3 staff training. So we know that staff training can support buy-in, unify workflows, and support patient experience. So join us for Microlearning 3 to learn a little bit more about this. And thank you to HRSA for supporting this content.
And for ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, on-demand resources, and more, or reach out directly to us at caltrc@ochin.org. And then finally, don't forget to sign up for CTRC's newsletter. You can use that QR code with your phone or other device and sign up right from there. So thank you so much for joining us, and we hope to see you at Microlearning 3.